you put a certain amount of emphasis in the winter plan on avoiding attendances at EDs and avoiding admissions, and that's only right. I mean, that's another logjam that, you know, a lot of people end up in EDs who really should have an alternative pathway. And of course, the difficulty is that in many cases there aren't alternative pathways. And I mean, that seems to be a key issue in respect of these log jams. And the advice going out to people is, you know, to seek assistance or advice locally, go to your GP, go to other facilities. But those other facilities don't actually exist. I mean, there's major pressure on GP surgeries at the moment, as you know, there's shortage of GPs. And then there are huge issues in relation to out of hours. So if somebody, you know, has a 6-month-old child with a very high temperature at 11 o'clock at night, what should they do? Are there any options available to them other than going to ED?
So, Dr. O'Connor may want to comment on this.
Yeah, and again, the challenges of providing care other than attending your emergency department is a big, significant challenge. There are options. There's 13 local injury units in the country. They provide about 110,000 attendances per year.
Most of them aren't open out of hours, though, sure they're not?
Well, we were just talking about options other than ED first and foremost, and I'll come back to the out of hours.
I'm saying about in that scenario, in the evening, out of hours, what are the options available to people?
So they're open out of hours. The local injury units are open out of hours. Most of them, in fact, actually most of them run a 7-day service, which would be classified as out of hours. Most of them do not operate a service after 8 p.m. So that's one option, and that's really for kind of maybe minor fractures, dislocations, sprains.
Okay, up to 8 o'clock.
Up to 8 o'clock.
Okay, I'm talking about emergencies that arise.
So the second option is we should also be cognizant of our general practitioner colleagues. So on an annual basis, there are 29 million GP consultations. There's 1.3 million emergency department attendances. So our general practitioners do a lot of the emergency lifting. The out of hours work done by GPs and consultations is 1.1 million. Actually, it's just shy of the ED attendances.
So, okay, they're the global figures. Yeah. I'm just saying about a parent with a very sick child at 11 o'clock at night. What are they supposed to do?
So a parent, we've all been in that situation. So clearly, obviously, from the point of view of obviously look at common sense. If you have that within yourself, you know the child is not that sick. If you need it, I'll take it there. I'll take it.
But what are their options?
So their out of hours general practitioner service is the first one, really, that most people would access as by virtue of the 1.1 million. And the second one, the second option obviously would be attending an emergency department. There are other options. Actually, the websites, the HSE has a very well.
Okay. Look, the reality is that the alternatives to EDs out of hours are wholly inadequate. Would you accept that?
No, I think that they're not as good as they should be, but I don't think wholly inadequate is. I think that would be.
This kind of is something that just stands to reason.
If
you don't want people who are sick or concerned about sick children or an elderly relative, if you don't want them to go to an ED, you have to provide an alternative. Now, at the moment, out-of-hours services are really only skeleton services. And I'm going to put it to you that, you know, there are several minor injuries clinics and several primary care centres around the country. Some of them extremely well equipped. But they're not advertised and they're not promoted because there aren't staff in them. And one obvious solution, in my view, is to recruit GPs who would be more than happy to work part-time, on salary and out of hours. And I'm asking, why do you not do that? We know that there's lots of, particularly female GPs, people with young children, it would suit them very well to work, that kind of shift on social hours. And to me, that is the blindingly obvious, that you should be recruiting salaried GPs to staff those centres so that there are alternatives to EDs. And have you considered that? And if not, why not?
Just on the question of salaried GPs, so definitely just to say, the hours of opening of, so GP out of hours are open 24/7, and we can show the numbers in terms of the volumes going through there. The reason some of the services are staffed and open for some times is staffing, but also not everyone arrives in the middle of the night. The volumes of people who go attend the ED, there's a well-known pattern as to when they do attend. In terms of salary GPs...
Well, sorry, of course, there is a real difficulty in getting access to an appointment, a same-day appointment with GPs. And
in some parts of the country. It's definitely variable. In terms of salary GPs, I'm not sure what the current policy position or whether that's been looked at. I don't know, Vaughan, if you had any comment.
Yeah, I was only going to. No, I was only add that the delimiter is the capacity, and you're describing it yourself in the way in which we bring the resources to the local based options. So, and just to say that off that one,
I don't know what that means. If you're trying to get people not to attend EDs, why don't you provide a realistic alternative service?
Currently, of the 1.1 million attendants at general practice, only 14% get a referral to ED. So we know that that is the model that's working. And in answering the question, the difficulty about just enhancing the capacity for general practice in hours and out of hours, the delimiter is the staffing, as you've described yourself. So what we want to do is develop those models.
Have you any idea what the limits are on employing GPs out of hours on a part-time basis?
Well, the current model of out-of-hours services isn't limiting how that employment is done. But if you're talking about direct employment by the HSE.
It's a skeleton service and based on the existing out-of-date contract.
Would you say, Deputy, as I understand it, the out-of-hours companies can employ GPs on a part-time basis and do employ GPs.
Why are we talking about out-of-hours companies?
Well, the out-of-hours service.
GPs? Why are you, as the health authority, not employing GPs to provide out-of-hours services?
Two quick points there, Deputy. Just in terms of your point about salaried GPs, so that is part, obviously, as you know, there's discussions going on around the new GP contract and elements of that in terms of expansion at the moment, in terms of the expansion of people who will be eligible for free care, and part of that is there are scenarios in some places where GPs are employed to cover in certain centres, and in terms of the LIUs, just to go back to your original question, we've opened one new LIU in Mullingar. There's a review going on to look at other places where we could support that, and we're also looking at staffing them and extending the hours through the winter. There's actually funding there to expand the hours to try and get them to a consistent piece. We do promote them actively through the various social media channels and so on, and through other local radio and so on through the winter. There's funding set aside for that. And one of the challenges, just one final point if I may, sorry, is just to say we do want to get to where they're all consistently running similar hours so that it's easy for people to understand what time they'll be open, when they can go to.
Then you have to get national agreement on things. Why don't you just try and recruit GPs to work part-time to staff out-of-hours services? And in that way, people will have an alternative to going to their local ED. So I think it's very regrettable that this hasn't been pursued seriously. You know, the then minister in 2018 announced that there was going to be salary GPs, and there has been zero progress on that. It is a proposal coming from the ICGP now again as a way of addressing this. But again, I would say it seems like the blindingly obvious, and it's regrettable that that hasn't been done.
Definitely, we'll take that away and discuss with colleagues in the department.
I'd appreciate if that was pursued seriously.
No, we can do, Debbie. And when I refer to out-of-hours companies, I should say these are GP cooperatives of GPs who we know are contractors in their own right, in line with the overall policy.
But the whole purpose of that is just to fulfil an element of the contract. It's not to actually provide a realistic service.
Well,
do you know, and that contract is very much out of date. So,
don't disagree.
You know, there's something to be said for you as the HSE to decide that you're going to recruit staff to cover out-of-hours services. And I would appreciate you pursuing that. Look, I just want to get back to the whole issue of workforce planning. We had long discussions on this, as you'll know, with Mr. Reid a number of weeks ago. And we were promised a whole lot of material. We were told that there were workforce plans and all that kind of thing. There's no evidence of those, I have to say. In the winter plan, there is a one-pager on workforce planning. And I really, you know, I'm just flabbergasted at the low level of workforce planning within the health service generally, both at department level and yourselves. So, you know, there isn't any medium-term planning, let alone long-term planning. And I just cannot understand why there isn't a serious function doing that. So we end up then, that there's money provided for services and there's no staff available, and you're going all around the world and all of that kind of thing, spending a lot of money. So you do say in this that you will ask, as part of the winter plan, you'll ask the emergency departments in hospitals and associated CHOs. You say they will outline what is required. They will outline. And again, that just underlines the fact that in the winter plan, you're saying they will outline. You've already said you can't deliver within 6 months. So why haven't they outlined long before now? And I want to ask you, out of those organisations, the EDs and the CHOs, who you're saying they will outline, how many of those have provided plans for staffing in terms of what they need? And can you provide us with those plans?
So Deputy, each of the 29 hospitals with an ED department have local plans. Colleagues can talk about the specific of the language and the will, but just go back to the bigger workforce planning issue. And maybe we need to provide more information, and I'd be surprised if we haven't provided it and we said we would, but we'll certainly check on that, Chair. So, but the bigger issue is we know the number of places for graduating nurses and healthcare professionals and doctors needs to be increased. We've seen the ESRI report recently, which makes it clear it needs to be more than doubled in some cases, and you've heard the Secretary General say that. And inside the HSE, we have established a specific kind of HR resourcing piece to look at our input to that process. So there's a lot of focus on growing the number of places. As you know, Deputy, that takes time and it takes investment. So
I haven't seen any evidence of a workforce plan. You talk about recruitment. There's no evidence of you doing a workforce plan to take us, say, over the next 5 to 10 years.
Well, as far we would disagree, Deputy. I mean,
it had been promised by your predecessor.
We have set out what we understand to be the numbers that are currently graduating and the types of numbers we need to get to in order to...
So can you provide us with those figures?
We'll provide you whatever is available within the HSE, we'll get it to you.
And who is responsible for workforce planning?
National Director of HR.
Okay, so I'd appreciate that. And if you could also tell us in terms of those, in respect of the winter plan, not the individual plans, give us the global figures that are arising from your consultation
global
with
figures
the EDs.
in terms of recruitment, or
what they need.
Sorry, Debbie.
Yeah, and you say in the plan that they will outline what is needed.
Can
you tell us?
So again, just the winter plan that you have seen is an overarching plan, and then there's, again, just to backtrack a little bit, and apologies if we haven't made it clear. So there's 29 bespoke plans, which are what people need, which is actually what you've mentioned.
Okay. Have you global figures then in terms of to address the ED?
Yeah.
How many?
So from the point of view of the 447 WTEs, general support is 8.5. Health and social care professionals, that therapy grade is extremely important. It's 100. Management and administration, particularly around patient flow issues, which is extremely important, is 46. Medical and dental is hardly dental. It's medical, I suspect, 40. Nursing and midwifery, 173.
Are they contained in the plan?
Yeah, they're the subset of the 447 local initiative staff that we mentioned earlier.
Because the plan says they will outline. Okay.
And the final category, I should say, just for completeness, is patient care and patient flow, 78. So that comes to 447 from each of the sites submitted.
Okay. Can you just repeat that request for any details of workforce plans that you have?
Yes, Debbie.
If you can provide them soon, please. Thanks.